In observance of World Sexual Health Day observed on September 4, youth organizations, namely SASUD, Aspire Youth Network Guyana, and the Guyana Responsible Parenthood Association, are making a public plea to the new government to implement strategies that they believe will help to improve sexual health among youth and also improve the way the health sector deals with issues surrounding sexual health. In an exclusive interview with this newscast on Tuesday via Zoom, Human Rights Coordinator of SASUD, Kobe Smith, and the Social Programming Director of Aspire Youth Network, Juliana Lopez, highlighted ways in which the new government can help to enhance sexual health effectively. Smith expressed that while the performance of Guyana's health workers is commendable, there is a need for specialized training to deal specifically with sexual health.
The approach that is used by some healthcare workers are sometimes not acceptable. And so we would advocate for healthcare workers to be adequately trained to provide non-discriminatory health services, to ensure that they respect the rights of persons, they respect their humanity, but also execute their services with dignity.
He also noted the strong need for the availability of PrEP for those at substantial risk of contracting HIV. Acknowledging that the PrEP system is unpopular in Guyana, Smith underscored the critical need for its usage in presenting more options to Guyanese to fight against HIV/AIDS. Pre-exposure prophylaxis, or PrEP, is a way to prevent HIV infection through the ingestion of pills. When someone is exposed to HIV through sex or injection drug use, PrEP can work to keep the virus from establishing a permanent infection. When taken daily, PrEP is highly effective for preventing HIV. Studies have shown that PrEP reduces the risk of getting HIV from sex by about 99% when taken daily. Among people who inject drugs, PrEP reduces the risk of getting HIV by at least 74% when taken daily. Meanwhile, the director of Aspire Youth Network, Juliana Lopez, implored the government to invest in mobile clinics and telemedicine, as she believes it will be a good initiative to deliver sexual health services during the COVID-19 pandemic.
Some communities do not have access to certain hospitals or clinics, and even if they do, the services that will be provided at said clinic might not be the same as like the Georgetown Public Hospital or any other private care, because you have to consider that some communities lack resources. So it's really important that we do have mobile clinics.
She also stressed on the importance of conducting age-appropriate, comprehensive sexual education in schools, stating that it will help students to learn how to adequately take care of themselves and their bodies.
It is very comprehensive, as it does look at health in a holistic manner and writes in a way that the sexual education curriculum prior, which was the human family life education curriculum, did not really look at it before.
Both Smith and Lopez are confident that if the government partners and supports civil society organizations, then Guyana will be one step closer to the overall improvement of sexual health services. For the HEP Nightly News, Kendell Richmond.